Trametinib tablet is a medication used to treat different types of cancers, including skin, thyroid, lung, solid tumors, and brain cancer. It is classified as a kinase inhibitor, and it works by slowing down or stopping the growth of cancer cells. The recommended dosage and the best time to take this medication will depend on your specific condition and should be discussed with your healthcare provider. When taking Trametinib tablets, it's important to follow your doctor's instructions. Usually, it's taken once a day, at least 1 hour before or 2 hours after a meal. If you vomit after taking the medication, do not take another dose. Instead, take your next dose at the regular time. If you're using the tablets, swallow them whole, do not crush or break them. If your child is using the liquid form, make sure to carefully measure the dose using the bottle adapter and oral syringe provided. The dosage is based on your medical condition and response to treatment, and for children, it's also based on weight. To get the most benefit from this medication, take it at the same time each day. It's important not to increase your dose or use this drug more often or for longer than prescribed. It's also important to note that since Trametinib can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets. If you experience dizziness, diarrhea, nausea/vomiting, stomach pain, dry/itchy skin, acne, or dry mouth, tell your doctor or pharmacist promptly. To relieve dry mouth, you can suck sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. You may also experience pain or sores in the mouth and throat. Be sure to brush your teeth carefully and avoid using mouthwash that contains alcohol, and rinse your mouth often with cool water mixed with baking soda or salt. It may also be best to eat soft, moist foods. Your doctor has prescribed this drug because he or she has judged that the benefit to you is greater than the risk of side effects. However, careful monitoring by your doctor may decrease your risk. This medication may raise your blood pressure, so be sure to check your blood pressure regularly and tell your doctor if the results are high. You should also tell your doctor right away if you have any serious side effects, including various signs of heart failure, lung disease, skin infection, muscle damage, kidney problems, easy bleeding/bruising, fever/chills, eye pain, vision changes, signs of bleeding in the brain, serious stomach/intestinal problems, sudden pain/swelling/redness, chest pain, or trouble breathing. Trametinib may also make your blood sugar rise, which can cause or worsen diabetes. Tell your doctor right away if you have symptoms of high blood sugar such as increased thirst/urination. If you already have diabetes, check your blood sugar regularly as directed and share the results with your doctor. Although this medication is used to treat certain skin cancers, it may rarely cause new skin cancer or other cancers. Tell your doctor right away if you notice unusual skin changes. Your doctor should check your skin before starting treatment, every 2 months during treatment, and for up to 6 months after stopping this medication. Trametinib can commonly cause a rash that is usually not serious, but you may not be able to tell it apart from a rare rash that could be a sign of a severe reaction. Get medical help right away if you develop any rash. If you notice any symptoms of a serious allergic reaction, including rash, swollen lymph nodes, itching/swelling, severe dizziness, or trouble breathing, get medical help right away. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking Trametinib, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication can contain ingredients that may cause allergic reactions or other issues, so make sure to discuss this with your healthcare provider. It's also important to inform your doctor or pharmacist about your medical history, especially if you have high blood pressure, heart disease, lung problems, bleeding or blood problems, diabetes, eye problems, or stomach/intestinal problems such as diverticulitis. When taking this medication, be cautious about activities that require alertness or clear vision, as Trametinib may make you dizzy or blur your vision. It's advised to limit alcohol consumption and to talk to your doctor if you are using marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women or those who may become pregnant, it's important to avoid handling this medication or breathing in the dust from the tablets, as Trametinib may harm an unborn baby. Your doctor should order a pregnancy test before starting this medication. It's also crucial to discuss reliable forms of birth control with your doctor during treatment and for 4 months after the last dose. For women who are breastfeeding, it's not recommended to use this drug, as it is unknown if Trametinib passes into breast milk and may pose a risk to the infant. It's best to consult your doctor before breastfeeding while using this medication. It's important to be aware that Trametinib tablet may interact with other medications, affecting how they work or increasing the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, you can contact a poison control center for further guidance. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. It's important not to share Trametinib tablet with others. Before starting this medication, you may need to undergo various lab and medical tests, such as heart imaging, blood pressure, blood sugar, skin checks, and weight monitoring in children. It's crucial to keep all medical and lab appointments for the proper monitoring of your health while taking this medication. If you forget to take a dose of Trametinib tablet, take it as soon as you remember. If it's within 12 hours of your next dose, then skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When storing Trametinib tablets, it's important to keep them in the original container in the refrigerator, away from light and moisture. Be sure to also keep the desiccant, drying agent, in the bottle and out of reach of children and pets. If you have the liquid form of Trametinib, store it in the original container at room temperature, away from light. Be sure not to freeze it, and keep the container upright and tightly closed when not in use. It's also important to discard any unused liquid medication 35 days after it has been mixed by your pharmacist. When you no longer need Trametinib or it has expired, it's important to properly discard it. Be sure not to flush it down the toilet or pour it into a drain. Instead, consult your pharmacist or local waste disposal company for guidance on how to dispose of it properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.